Welcome to our presentation on motivation in individuals with amputated limbs. This was created by Emily, Jack, Matt, Maya, Sydney, Valentina, and Vanessa. We hope you enjoy.
Learning outcomes. During this lecture, we will go over multiple factors of individuals with amputations and how motivation plays a role. By the end of this lecture, we will expect you to understand the overview of individuals with amputations, such as what an individual with an amputation is and what type of devices they use for daily living activities. We'll also be going over how motivation plays a role within individuals with amputations and how utilizing different therapeutic techniques can lead to beneficial outcomes of motivation to these patients.
Before we start this presentation, we wanted you guys to take a second and reflect on some of these thoughts and ideas. Starting with, have you ever known someone or been around an individual who has lost a limb? If you were able to answer yes to that question and thought of someone who has lost a limb, how did that individual's life change? Now, how do you think the changes impacted the individual? So as we go through this presentation, we want you guys to try to relate as much as you can to an individual who has lost a limb and try to picture yourself in their situation.
Introduction. So what is an individual who has an amputation? When it comes to the definition of amputation is the traumatic loss of a body part. A loss of a body part can range from finger, toe, arm, or leg. When it comes to devices, a prosthetic device is often used to replace the limb for the individual. Prosthesis devices can be used for upper and lower limbs to function for daily living activities. Amputation can occur in multiple different ways. Amputation can occur when disease of a limb cannot be cured or when a life-threatening condition is present. For example, amputation of a limb can occur due to a traumatic event such as a car accident, where amputation is an urgent need. Another example, it can occur due to a cancerous tumor where a limb has to be amputated to stop the spread. Individuals with amputations have reported emotions such as grief and bereavement when losing a limb, due to the loss of a limb where a prosthesis device has replaced the original limb. Some patients were preoccupied with the feeling of loss, which can affect and overall decrease their quality of life. On this slide, we have a couple of examples of amputations. On the left side, we are able to see an individual with a lower leg amputation. We can see that they have a lower limb prosthesis device, which is used to restore the functional ability of the lower left leg. And the prosthesis device is used to replace a missing part of the body to make daily living life easier for the individual. And on the right side, we are able to see an individual with a left arm amputation. We are able to see that they have an artificial limb, which is designed to replace the missing arm. And these were created to improve an individual with an amputation's comfort level, reinforce their self-image, and increase mobility.
Individuals with limb amputations have a disability that significantly affects daily functioning. The limitations presented by body structure decreases the individual's ability to participate in everyday activities and therefore decreases the quality of life. After the loss of a limb, people experience a range of complex emotions such as fear, anger, or guilt due to an overwhelming sense of loss. In a qualitative study that interviewed 12 people with post-traumatic lower extremity amputation, there were several identified themes presented by the effects reported. Anxiety and depression levels increased, as well as a negative perception of body image and self-esteem. Due to societal expectations, people with limb amputations feel as though they are inadequate to function properly with their environment. Additionally, the study mentioned the emotional burden the individuals experience due to their disability. Oftentimes, people with amputations believe that they are burdening their families and friends with their limitations. Both physical and mental support from peers is extremely necessary to improve the attitudes and perceptions of people with amputations. This table is pulled directly from the study, which highlights and summarizes the important themes I previously mentioned. As you can see, they are encompassing of the psychological effects that the population experiences. Acknowledging the stress placed on mental health for people with amputated limbs helps to facilitate interventions that can promote positive change.
Motivation plays a large role in everyone's lives. It played a role in getting all of us into Temple's physical therapy program, and it plays a role in helping individuals overcome changes in their lives. Losing a limb can impact an individual both physically and emotionally. Specifically, we are looking into how an amputated limb can impact one's emotion in terms of motivation. Motivation is the driving force behind an individual's actions towards achieving their goals. There are two types of motivation, one being intrinsic and the other extrinsic. Intrinsic motivation comes from within. It's the internal drive that an individual feels when they want to feel gratification. For example, intrinsic motivation could be when an individual wants to run a marathon because they never have before and it has been on their bucket list. Extrinsic motivation comes from outside an individual. This is where individuals get motivation from other factors besides within themselves. These factors could include money, trophies, and social recognition. For example, extrinsic motivation would be wanting to run a marathon because there's money that you can get for placing in the race. Studies have shown that after losing a limb, individuals often experience an increase in anxiety and depression. This increase correlates to a decrease in one's motivation, specifically intrinsic motivation, coming from within.
It's easy to see that motivation can positively and negatively impact the lives of those with an amputation. In this case, motivation can be a great battle if someone decides one day that they need an amputation due to a health condition, or maybe an accident happens that changes their lives forever. So it's important to see how the negative impacts change, because you can turn the negative into a positive, and vice versa, positive may become negative. So motivation within the population, with it being positive and negative, it definitely varies. To explain that more in detail, research has shown that motivation, it is not necessarily an objective finding. It is more of a subjective, not one-size-fit-all type of idea. To go off of that point, intrinsic motivation, as defined in the previous slide, is defined as motivation that comes from within, compared to its extrinsic counterpart. In this case, it is not universal, it is more personal, which means that if you have a room full of amputated individuals, they all will have different types of motivation that will affect each person differently. With that being said, there are multiple factors that can either increase or decrease motivation, and also it helps to fight this battle, this negative battle. Now, the personal relationships, that piece can be a mother, a father, maybe some friends, anyone that you're related to, any kind of relationship that you can benefit from. So, for example, if someone has an amputated leg, they have their sibling caring for them. So having that person with you by their side is something that definitely can help this whole recovery process and basically whole lifestyle be a little bit better. Now, there are barriers. The barriers can be a physical inability. It could be maybe a personal relationship. It could be negative. Maybe there's a spouse or significant other that maybe thinks that they can't deal with their partner having an amputation, things like that. The physical barriers would be like going to the store and you have to get a wheelchair or any kind of assisted device. There are, on the other hand, facilitators. So as pictured on the right, you can see that this looks like it is some kind of run or walk that raises awareness for people with amputated limbs. And you can see that there are people with amputations in the picture, and it looks like they have good personal relationships, and this increases motivation. She obviously is smiling, she's happy, she's having a good time, and this is really what we want when increasing motivation, because if you have a nice support system, then it makes life a lot easier. To drive home this point that motivation can be a battle with people that have amputated limbs, I've included a diagram that shows different factors that may influence levels of motivation. Let me start by defining what the types of motivation may look like. So in this case, it would be interpersonal or intrapersonal. Interpersonal motivation means that this type of motivation can be seen among yourself and other people. An example of this would be if I am playing a sport and I am very excited to play this sport. I am smiling, I have good body language, and I am communicating, laughing, making jokes. It is very easy for me to be happy and show other people that I am happy that I enjoy this sport. An example of intrapersonal is something that happens within. So in this case, with the diagram, it would be feelings, thoughts, and beliefs. So a feeling, so if I, for some reason, don't enjoy a particular sport, I would feel maybe bored, tired, any kind of negative feeling. And people they won't always see this. So I could definitely cover up these feelings. I definitely don't have to say my thoughts. If I think this sport is boring and I don't enjoy it, I can keep that inward and not tell anyone, and no one would ever know. And then in terms of beliefs, there are beliefs in yourself, others, and the future. And these beliefs may be rooted in the amputation that the patient has experienced. So, for example, it would be a belief in myself that I can or cannot do something. And then the future would be like if you have done something in the past and then you experience the amputation, like what your future looks like. And then any kind of other beliefs that show maybe with the amputation, you don't believe that you should be doing a certain thing, or that you should never be able to learn how to do something. So basically, the main point here is that motivation comes from within and outward, and there are these different concepts that play a huge part in not only motivation, but eventually self-efficacy as well.
Now pretend you are a licensed physical therapist in 3 years from now, and your patient is an individual who has an amputated limb. Their motivation may not be the best, and you're thinking about ways of how to structure and plan your therapy session with them. Have you ever thought about including video games as the main source or plan of therapy? It has been found in lots of past studies that therapy sessions based on fun and playful concepts actually produced better therapy outcomes than traditional therapy exercises, specifically in individuals with amputated limbs. There have been other studies that have found that music, control mechanisms, the ability to receive upgrades, so in a game, how you can upgrade to another level, and enjoyment positively influence patient motivation. And lastly, adding on to that, therapy sessions that included choice, rewards, and goals increased patient engagement throughout their therapy session. So how video games, you have that choice of what decision you want to make while you're actually playing the game, or let alone the choice of the video game itself. And you get a reward. If you won, you did really well, you get points. It made therapy more fun and it increased that engagement rather than just doing your typical therapy exercises. Therefore, when thinking about how to plan a therapy session in your future as a PT, you might consider maybe using a video game, and keep in mind these other factors that are listed that have produced really good positive outcomes within patients and their therapy sessions. A more specific example of using video games as therapy was done in a study conducted in 2021 with 10 participants total. 5 were able-bodied participants and 5 were individuals with transradial amputations. The purpose of this study was to observe and analyze if video games as rehabilitation improved muscle strength, coordination, and motivation. The participants played 4 different video games, which are listed at the top. I was most familiar with Fruit Ninja, which I'm sure we're all pretty familiar with. And they played these games over a 4-week therapy period with a myoelectric prosthesis. To test if these video games actually improved their muscle strength, there needed to be a baseline test to see if scores in their baseline test increased after this 4-week therapy session. So those tests included a virtual reality blocks test, and an EMG assessment were conducted prior to this 4-week therapy session and then after this 4-week therapy session. They observed to see if an increase in assessment scores occurred after the 4-week therapy period. The results and conclusion from the study were that using video games as therapy increased patient muscle strength, coordination, and control. It was also noted in the study that patients reported high levels of actually wanting to play these games, and they saw that playing the games was their own choice, and they felt competent during therapy. They didn't feel that it was just the therapist telling them what to do and that they were at therapy and they just had to sit there and listen and do what they had to do in order to go home. And going off of that, these patients remained really motivated throughout their entire therapy session for a longer period of time, meaning that in their hour-long of therapy session, they might have remained motivated and really engaged for 45 minutes, whereas opposed to playing these video games, they might have only lasted 20 minutes of having really good motivation and engagement throughout their therapy session. So overall, this study has shown that video games increase patient motivation, and it's a really good way to keep patients engaged and motivated throughout a therapy session. And the picture on the right, the top picture, is actually one from the study in itself of one of the assessments that I mentioned in the previous slide of the block assessment to assess if their score increased and therefore if the video games increased their score from that game.
Another case study of video games as therapy consisted of 7 upper limb amputees. Out of the participants, only 1 had prior experience in controlling a prosthesis. The purpose of the study was to evaluate short-term effects on EMG controllability after a video game-based rehabilitation protocol. Also, to evaluate the impact and value of the games on the patients regarding motivation, performance, and effort. 3 video games with different control methods were played and evaluated in this study, with a game for dexterity, a racing game, and a rhythm game. Additionally, the participants underwent 3 EMGs consisting of pre-gaming, post-gaming, and a follow-up that each lasted 10 minutes.
Ultimately, the results showed an improvement in overall EMG control, fine muscle activation, and electrode separation. However, the patients reported that the racing game was more superior than the others, but the rhythm game was more challenging. There was also an improvement in fine accuracy and coordination from the pre-gaming measurement to the follow-up measurement. The image shows the percentage of the opposing electrode activation during the precision control assessment. Based on the data, the percentages increased for all the measurements, showing a positive impact on how video games can be an excellent choice of therapy.
As we've seen, video games have both physical and motivational benefits for patients with amputations. Many of these studies use elaborate virtual reality setups in labs that are helpful but may not be accessible for all people with amputations. Recently, there have been more and more accessible options coming out for people with amputations to participate in gaming. These are things that people with amputations can purchase themselves and use in their homes. Many people are probably familiar with the Wii system, and the Wii Fit board has been studied as a supplement to exercise programs prescribed for people with amputations and physical therapy. It has shown to be a great modality for people with lower limb amputations, as it is more entertaining than conventional rehabilitation and can improve their balance. Wii Fit has shown to improve balance confidence, which motivates engagement in more physical activity. Xbox has also come out recently with an adaptive controller that is designed to meet the needs of gamers with limited mobility. This controller makes gaming more accessible for those with upper limb amputations. To design this controller, Xbox took input from the Able Gamers charity, the Cerebral Palsy Foundation, Special Effect, Warfighter Engaged, and many more community members. These groups helped design the controller and the way that it works. Because playing video games can improve muscle control, strength, balance, and fitness for people with amputations, it is exciting to see video game companies designing accessible products for this purpose.